Vaccines have helped prevent many infectious diseases that in the past caused great morbidity and mortality. However, for vaccines to be effective, they must be stored, handled, and administered appropriately and correctly. Studies have shown that improper vaccine administration technique can result in suboptimal immunogenicity. Improper administration can also increase the risk for severe adverse reactions. It's important that healthcare providers administering vaccines understand and follow current national professional standards and guidelines. This program, created as a practical tool for training new employees or as a refresher for current healthcare providers, should be used as a complement to your institution's training process. Vaccines are oral, nasal, or injected preparations made up of dead or weakened infectious agents such as bacteria or viruses. Vaccines work by stimulating the production of antibodies, resulting in immunity to that particular infection. Some vaccines induce prolonged or even lifelong immunity to certain infections and can be given just once. But others, such as pertussis or diphtheria, only induce temporary immunity and require repeat injections to maintain protection. This program will focus on injected vaccines administered either via the intramuscular or subcutaneous routes. Before any vaccine administration, patients should be screened for their current state of health and any potential contraindications, including past adverse reactions to vaccine components. Note that children and adults can still be vaccinated if they have a current minor illness, such as an upper respiratory tract infection, diarrhea, or otitis media, with or without low-grade fever. Also, to ensure informed consent, the provider must discuss the benefits and risks of the vaccine with the patient or parent caregiver using relevant resources. It's important to confidently answer any questions the patient or parent may have. The Public Health Agency of Canada recommends the CARD, Comfort, Ask, Relax, Distract framework, an evidence-based educational system for vaccinating individuals. Each letter category includes evidence-based interventions that reduce immunization stress-related responses, or ISRRs, such as fear, pain, dizziness, and fainting. This improves the vaccination experience, which in turn increases confidence in vaccination and improves vaccine acceptability. The setup of the vaccination clinic is important to making patients comfortable and minimizing immunization-related stress. CARD recommends that vaccination clinics be set up according to these standards. There should, ideally, be separate physical spaces for waiting, injection, and aftercare with one-way flow-through. Seating should be available for the patient and a support person. During injection, patients should be able to sit and lie down. Individuals should have the ability to be vaccinated in private, out of view of others. Minimize clutter and fear cues like needles, equipment, and loud noises. Control the temperature to make people comfortable. The words and actions of healthcare providers can influence how someone experiences vaccination. Some behaviors can promote coping, while others can increase distress. Foster a calm environment and be positive. If you are calm and use your normal voice, others will feel that everything is okay. Provide information using neutral language. Do not use words that can be perceived as threatening. For example, say, "I am giving you the vaccine now," instead of, "You are getting your shot now." Acknowledge concerns and provide balanced information. Do not minimize or dismiss people's concerns. Children are more frightened of vaccine injections and report more pain compared to adults. Child and parent caregiver preparation ahead of time and on the day of vaccination can reduce their fear and pain. Numerous strategies are available in the different letter categories of CARD that can help children and their parent caregiver prepare for a vaccination appointment. Ask the child and their parent caregiver if they have any concerns related to the vaccine and its administration or about coping strategies, and answer questions they may have. Offer options for coping in the different card-letter categories. Options will vary depending on child age and preference. Some strategies may be administered by caregivers. Specific card strategies will be described later in this video. Healthcare workers can provide children and parents' caregivers with information ahead of time to allow them to plan coping strategies. That way, children can come prepared by wearing a short-sleeved shirt to facilitate access to the site of injection, bringing a comfort item from home, have a snack before and after injection, use age-appropriate coping strategies. For babies 12 months of age or younger, breastfeeding before, during, and after vaccination is the preferred intervention to reduce pain. If an infant is not breastfeeding, breastfeeding can be simulated by holding infants and administering sugar water with a pacifier. Infants should be held instead of left lying supine during vaccination. Toddlers can be held by a parent caregiver in a comfort position, such as sitting on a parent's lap in a bear hug position with limbs gently secured, and offered a distraction. Older children can self-select preferred coping strategies from the card-letter categories. Examples include picking a comfort position, asking for information, relaxing by taking deep belly breaths, and using a distraction. It is important for providers to invite children and parents' caregivers to use their preferred coping strategies and support them in their choices. This promotes participation, increases agency, and improves satisfaction. After injection has occurred, pain may need to be managed through active techniques. Pressure at the site of injection for 10 seconds may reduce pain. Ice isn't recommended, as it provides only a few seconds of pain control. For details, consult your local institution policies. Today, with the increasing number of childhood vaccines, it's not uncommon that babies and children may require multiple vaccines in the same clinic visit, administered sequentially at separate sites. There are no contraindications for giving multiple vaccines, and all opportunities for vaccination should be explored. Of current relevance, the COVID-19 vaccine can be co-administered in adults with other vaccines, for example, the influenza vaccination. When giving multiple injections, a separate syringe should be used for each injection. It's important to note that different vaccines should not be mixed in the same syringe, unless specified by the manufacturer as part of the Reconstitution and administration procedure. It is also important to ensure that the vaccine administered can be given with other vaccines. This depends on the vaccine and, in some cases, the age of the patient. When necessary, 2 vaccines can be given in the same limb at a single visit. For infants up to 12 months, the thigh muscle is the preferred site for 2 simultaneous injections because of its bigger muscle mass. The distance between the 2 injections should be about 1 to 2 inches. Vaccines that are known to cause more stinging or pain should be given last. When choosing to give injections at multiple sites in infants, administering them simultaneously by 2 different providers may reduce the anticipation and anxiety of the next injection. For older children and adults, ask about their preferences for simultaneous injections. While speaking to the patient and preparing the vaccine, it's important not to be in a hurry, as patients are more distressed or anxious when they feel the process is being rushed and their concerns are not being addressed. Recognize the efforts anxious patients are making. Help them to remember their vaccination in a positive way for the next time. Ask about past experiences and preferences for coping. Ensure coping strategies are available to support individuals, such as distraction items. Prepare the vaccine out of the sight of the patient and keep needles and other fear-provoking equipment obscured from view. Answer questions using neutral language. Tailor the information to the patient's needs. Do not dismiss a patient's concerns. Ask patients how they are feeling, both before and after the procedure. Ask how you can make the experience better. The Canadian Immunization Guide recommends that healthcare providers inquire about a patient's past history of pre-syncopal or syncopal reactions. This includes symptoms such as pallor, weakness, dizziness, lightheadedness, or nausea. Syncope or fainting is more common in patients with needle fear. Patients prone to syncope or fainting can be advised to lie down during the vaccine administration or to use muscle tension to prevent it. Muscle tension is an exercise that involves alternating between tensing and releasing large muscle groups, like the legs. This action increases blood pressure and prevents fainting. The exercise is continued until the procedure is over or the faint feeling is relieved. It's important to have all the necessary equipment or material on hand, including appropriately sized syringes, a selection of needles, alcohol swabs, cotton balls, a sharps container, and gloves. In addition, it's important to have emergency medication, supplies, and equipment on hand to assist with the management of anaphylaxis. You should know and follow your institution's policy and procedure for the management of possible incidents of anaphylaxis. Personnel administering vaccines should take appropriate precautions to minimize the spread of disease to or from patients. They should also have evidence of immunity or be immunized against measles, mumps, rubella, varicella, hepatitis B, influenza, diphtheria, tetanus, and pertussis. Hand hygiene should be performed before vaccine preparation, between vaccine recipients, and more often whenever the hands are soiled. Gloves are not required when administering vaccines unless the healthcare worker has open-hand lesions or anticipates contact with potentially infectious body fluids. Vaccines can be supplied in single-dose vials, multi-dose vials, and pre-loaded syringes. It's important to ensure that the dose is appropriate for the patient's age. A lower than recommended dose for a particular vaccine can result in suboptimal vaccine potency. Conversely, exceeding the recommended dose may result in more tissue or systemic reactions. In addition, before drawing up the vaccine, the healthcare worker should perform thorough hand hygiene. Assure that the vaccine storage conditions are appropriate by checking the temperature monitor chart. Inspect the vaccine product to ensure that there are no irregularities, such as damage or contamination. Check that the color and appearance of the vaccine are correct. Check the vaccine identification label and expiry date on the vaccine package. If the expiry date indicates only the month and the year, the vaccine can be used until the end of the indicated month. Note that multi-dose vials should be labeled with the date of the first entry into the vial and, unless specified by the manufacturer, should be discarded 30 days from the date of the first entry. Once the patient is ready to receive the vaccine, the syringe can be filled as follows. Uncap the vaccine vial. Clean the rubber stopper with an alcohol swab and let dry. Pull back the plunger to fill the syringe with an amount equal to the amount of vaccine to be withdrawn. Remove the needle guard and place it where it will not be contaminated. Holding the vial upright, insert the needle directly into the center of the rubber stopper. Do not inject air into a multi-dose vial prior to withdrawing vaccine. Injecting air may produce a spritz of vaccine that is lost each time the air is injected, resulting in a decrease in vaccine contained in the vial over time. Invert the vial and draw up the vaccine while keeping the bevel of the needle within the solution to avoid drawing air. For a single-dose vial, withdraw the entire vial contents. For a multi-dose vial, withdraw the desired amount of vaccine. Remove the needle from the vial and gently expel air bubbles from the syringe by tapping on the side of the syringe while pushing the plunger. Make sure you do not expel any of the vaccine. When possible, give the vaccine immediately after drawing it up into the syringe. Syringes and empty vials should be discarded into a biohazard container. Preloading syringes with vaccine is discouraged because of uncertainty of vaccine stability in syringes, risk of contamination, increased potential for vaccine administration errors, and vaccine wastage if not given. Depending on the vaccine preparation, the healthcare provider may need to reconstitute the vaccine with a supplied diluent. Here are some guidelines for proper vaccine reconstitution. Ensure that you use only the diluent supplied by the manufacturer. Verify the expiry date on both the vaccine and the diluent. Remove the cap from the vaccine vial. Clean the rubber stopper with an alcohol wipe and allow it to dry. Draw up the diluent into your syringe and inject it into the vaccine vial. Caution: injecting the diluent too rapidly or shaking the ampule may cause frothing, which can affect the dilution and thus the potency of the vaccine. If the freeze-dried powder does not instantly dissolve in the diluent, gently rotate the ampule until it dissolves. Whenever the solution and container permit, inspect the vaccine visually for particle matter and discoloration. If problems are noted, the vaccine should not be given. Fill the syringe as directed in the previous section on drawing up vaccines. Note that it's not necessary to change the needle after reconstitution of the vaccine unless the needle has become bent or contaminated. Once reconstituted, the vaccine must be administered within the timelines provided by the manufacturer, or it must be discarded. Injectable vaccines are administered via the intramuscular, IM, or deep subcutaneous, SC, routes. Healthcare providers should be familiar with and comfortable with these two routes of administration. Vaccines are also available for intradermal injection, oral administration, and via intranasal spray. This program will review the IM and SC routes only. For complete vaccine administration information, providers should refer to the package insert and the current Canadian Immunization Guide or the National Advisory Committee on Immunization Statement. Once the provider has determined which route a particular vaccine requires, the next steps are 1. To choose the site of injection, and 2. To choose the appropriate needle size. These decisions are made depending on the age of the patient to be vaccinated. The recommended sites for IM injection are the vastus lateralis muscle of the anterolateral thigh or the deltoid muscle of the upper arm, depending on the age and the degree of muscle development. For children less than 1 year old, the recommended site for IM injection is the anterolateral aspect of the thigh. Most clinicians agree that once an infant is walking, the deltoid muscle is preferable. Never use the gluteal muscle for IM vaccination, as it's highly unlikely that the vaccine will reach the muscle, and there's a risk for damage to underlying structures, such as the sciatic nerve. In addition, some vaccines may have reduced immunogenicity when given in the gluteal muscle. Vaccines containing adjuvants are to be administered via IM injection. If inadvertently injected subcutaneously or intradermally, increased inflammation, induration, or granuloma formation may occur. For older children and adults, the deltoid muscle is the preferred site for an IM injection. The needle is 22 to 25 gauge for an IM injection. It's important for the needle to be long enough to reach the muscle, and this, of course, depends on the size of the patient being vaccinated. Needle selection should be based on the route of administration, the individual's age, the size of muscle mass, and viscosity of the vaccine. For infants, the needle length should be between 7/8 and 1 inch. For toddlers and older children, the needle length should also be between 7/8 and 1 inch. For adolescents and adults, the needle length should be 1 to 1.5 inches. It is important to maintain patient comfort during vaccination to minimize the risk of injection administration errors. In general, infants should be held by a parent or caregiver, and older children and adults should be sitting upright rather than lying supine. Ensure that the site of vaccine administration is accessible and that the limb being vaccinated is stable. Age, activity level, and the level of anxiety or fear of the patient and/or caregiver influence the position selected. For young children, offer positions that support and contain the limbs. For example, bear hug in a toddler with parents' arms over the child's arms. In general, the following patient positioning instructions apply to both IM and SC injections. The patient should be in a comfortable position. Ensure the vaccine site is easily accessible. Fully expose the appropriate area and avoid tight clothing above the injection site. Expose the upper arm fully. The muscle should be relaxed, so encourage the patient to either let the arm hang by the side or rest the arm on their lap or hip. Babies and infants should be held on their parents' or caregiver's knee during vaccination instead of being left lying supine. The parent or caregiver should gently yet firmly hold the child during the procedure. Physical closeness can help comfort the child. If the injection is given in the deltoid, the parents should keep the free arm tucked behind them with the child cuddled into their body. Older children may sit on their own, but the parent or caregiver may still be required to help hold the arm still. Following injection site selection, prepare the area with an alcohol wipe using a circular motion starting from the center outward. Allow the area to dry. With your free hand, hold the skin firmly but not bunched between your thumb and forefinger, isolating the muscle. Insert the needle fully at a 90-degree angle and inject the vaccine into the muscle. Withdraw the needle and apply light pressure to the injection site for several seconds with a dry cotton ball or gauze, especially if bleeding occurs. Do not rub the area, as studies suggest that rubbing can decrease vaccine absorption. If using a retractable, safety-engineered needle, you'll need to apply slight pressure to the plunger to ensure the needle retracts. Some vaccine providers prefer to pull back on the plunger to determine whether the needle has entered a blood vessel. There are no studies that have assessed the need for aspiration prior to IM injection of vaccines in relation to vaccine safety. Some syringes provided for immunization may not allow aspiration before giving the vaccine. Subcutaneous vaccines are injected into the fat tissue below the dermis but above the muscle. While there are many possible sites for subcutaneous injection, the usual sites selected for vaccine administration are the upper thigh and the outer triceps of the arm. The needle is 25 gauge with a length of 5/8 inch for subcutaneous injection. With the patient properly positioned, subcutaneous injections are administered as follows. After appropriate site selection, prepare the area with an alcohol wipe using a circular motion starting from the center outward. Allow the area to dry. Bunch or pinch up the skin and fat between the thumb and forefinger to lift the fat tissue away from the underlying muscle. Insert the needle at a 45-degree angle and then slowly inject the vaccine into the tissue. Withdraw the needle and apply light pressure to the injection site for several seconds using a dry cotton ball or gauze. Do not rub or massage the site post-injection. With injected vaccines, there is a risk of transmission of blood-borne or body fluid-borne pathogens. Using proper sterile and aseptic techniques minimizes the risk of cross-infection during the immunization process. The following steps can help prevent needle stick injury. Use safety-engineered needles. Immediately after vaccine administration, dispose of all needles and syringes in a proper, clearly identified and puncture-resistant sharps container. Never attempt to push contents down into a full sharps container. Make sure that the sharps container is not accessible to children in the room. Ensure appropriate disposal of used vials. Discard as appropriate all used swabs or gauzes which may have been contaminated with blood. Healthcare providers should report any needle stick injury to their supervisor or occupational health and safety person and follow their facility's needle stick injury protocols. Every facility administering vaccines should have a protocol and equipment in place to provide immediate care for an anaphylactic reaction. These protocols, as well as equipment and supplies, should be reviewed regularly. Staff members must be able to recognize and respond appropriately to such an emergency situation and should maintain their current CPR certification. Fortunately, anaphylaxis is very rare, but the Canadian Immunization Guide suggests observing patients for 15 to 30 minutes following vaccine administration. Each healthcare provider should use their professional judgment to determine if a longer wait period is necessary. Patients and parents should be given clear and simple instructions on how to manage any possible side effects and to report any significant adverse events. Attention should be given to pain control as necessary, depending on the individual situation. It's recommended to use an empathetic, comforting, and relaxed tone in answering any specific questions the patient or parent may have. Any and all vaccine administration should be fully documented in the patient's medical record. The following information is necessary: date of vaccine administration, name of vaccine, vaccine lot number and expiry date, vaccine manufacturer, administration site, any pertinent comments, remarks, side effects, or observations, name and agency of the vaccine administrator. The patient or parent should be given an immunization record, which includes the vaccines administered, the dates of the administration, and the name and title of the person administering the vaccine. Individuals should be instructed to keep the record in a safe place and to bring it to immunization visits. Parents should also be instructed to maintain these records on behalf of their children and pass them on to their children at the appropriate time, such as when they are leaving home. Proper vaccine administration technique assures optimal potency and the reduction of local side effects. It's important for all healthcare personnel administering vaccines to be familiar with the appropriate preparatory, vaccine injection, and follow-up procedures for both children and adults. In addition, healthcare providers are encouraged to make the vaccine administration session as positive as possible. A positive experience will help ensure follow-up and acceptance of future vaccinations, and, of course, will enhance the relationship between the healthcare provider and patient. This program is intended to complement your facility's existing immunization technique training process. The contents of this program are based on the general recommendations of the Canadian Immunization Guide, 7th edition.